And finally, a new technique for cornea transplants is offering hope of restored vision to people with fading sight. NHS Lothian has carried out the first operations in Scotland using the process, which is a huge advance over traditional methods. Gordon Cree has been finding out more.
Hello. This is good. Come on in.
Until a few months ago, Joyce's eyesight was getting worse and worse. Aged 87, poor vision was having a major impact on her life.
It had deteriorated quite gradually, but it had got to the stage that I couldn't read books and newspapers. I had to say thank God for Kindle, which I was able to enlarge the text and read. But as our confidence goes, you can't walk about quite the same because you're not seeing obstacles too clearly, so I would fall about a bit. And the worst thing was, of course, that I had to give up driving.
But now she's become the first person in Scotland to have a new kind of cornea transplant. The damaged part at the front of her eye was changed for material from a donor.
Well, just you imagine just a blurred eyesight to seeing totally clearly. It's simple as that. I'm astonished at the colour of things. Now that is just lovely. I can't believe the fact I see things in 3D and in beautiful colour.
The technique replaces a much thinner layer of corneal tissue than the traditional method. That means a much smaller incision and just one stitch or even none.
It takes about an hour to do under local anaesthetic and amazingly quick recovery. So within 2-3 days they're able to see better. Within a week there's a significant improvement in vision, and within a month they can actually be seeing 20/20.
The doctor has gone on to do several of the operations.
The eye in question had a sort of mist over it, which has gone completely. And I have had no pain and no medication necessary other than drops, obviously. And I have been extremely pleased with what's been done.
The next step is for more surgeons to become familiar with the process, making it widespread.
So with this technique being new, the first patients are beginning to see the benefits, but the vision for the future is of it making a difference to thousands of people across Scotland. Gordon Cree, STV News, Edinburgh.